experts speak on the efficacy of traditional therapy versus alternative therapies for PTSD of active duty military and veterans returning from war. Every day in the United States, 22 veterans commit suicide. The capacity of the mental health system to treat and care for soldiers returning with PTSD is failing. The VA does not have adequate resources for soldiers and veterans, forcing them to seek alternative therapies. The increase in military members returning from war with PTSD has also increased dramatically in the past decade. Which therapies treat PTSD most effectively, and what do the experts say? Our first expert is Rick Yunt. He is a licensed social worker and the creator of Warrior Canine Connection. Our second expert is Matthew Young. He has a PhD in neuroscience and his research is focused in neuropharmacology and neurobiology of anxiety and fear. Rick Yunt advocates for alternative therapies for veterans with PTSD, particularly service dogs. He noted that PTSD is typically caused by humans, therefore humans may be a trigger for PTSD. However, dogs are perceived as trustworthy and give the veteran a sense of security. The methodology of the research Yunt did to analyze the efficacy of the canine effects on PTSD was geared towards observation of behaviors before, during, and after the study. He also used scales that the patients could measure symptoms throughout the study as well. His methodologies were qualitative in nature without the use of biological measures. He was able to draw on knowledge, value, and skills he developed in many courses within a purposefully designed curriculum for social work. His knowledge was particularly regarded to the canines, and their reaction with the patients with PTSD was drawn on a successful career as a social worker for children in foster care. He observed the interaction between a foster child and his own dog, and that is what gave him the idea to start the Canine Project. What he observed of the patient's symptoms when the canines were used was increased patience and impulse control, emotional regulation, improved ability to display affect, decrease in emotional numbness, improved sleep, decreased depression and startle responses as well as pain medication, improved parenting skills, and family dynamics. They also became less reliant on powerful antipsychotic medication. Matthew Young advocates for MDMA, also known as the drug ecstasy, and other pharmacological drugs that have positive effects on PTSD when combined with psychotherapy. These drugs also improve fear extinction and learning how to extinguish fears. This is also considered an exposure-based therapy for PTSD. He hypothesizes that the PTSD symptoms were much improved with MDMA-assisted psychotherapy that lasted for years after treatments to help extinguish conditioned fear responses at the molecular level. When combined with psychotherapy, MDMA demonstrated profound mood-elevating properties, positive social behavior, and other mood elevators. The veterans who engaged in pharmacotherapy and psychotherapy do have better outcomes than those who engage in pharmacotherapy alone. In recent studies, veterans were 5 to 12 times more likely to prefer psychotherapy over medication. Young was able to research the efficacy of MDMA by utilizing lab rats. He followed scientific protocol in every stage, and he gathered information, formed a hypothesis, predetermined control measures, tested the medications, recorded the data, and then analyzed the results. The two experts have their own opinions, but they also have some things in common. Rick Yunt says that pharmacology is ineffective in some cases. There's lack of support in some of the families, so if they only take the pharmacology therapy, then there's not the support of the family or learned new learned behaviors that they would gain from psychotherapy, and some of the medications are very dangerous. Matthew Young says that drug therapies do help, and with his particular drug therapy, it treats the patient at the molecular level and helps them to relearn responses. They both agree that pharmacotherapy and psychotherapy, when combined, are more effective than pharmacotherapy alone. References.